I'm a little busy today, right? Thank you very much, John. So I'm Dan Hashimoto. I'm at Mass General in the Surgical AI and Innovation Laboratory. So I would guess that most of you recognize a room like this, either because you've been in a room like this yourself, or you enjoy watching medical dramas about my day job. And a lot happens in this room. And a lot of the events that occur over the course of an operation can help us as surgeons better understand the outcomes that our patients may have. And there are a lot of questions that come up. Did a complication happen during the operation? Is there an increased risk of infection or bleeding after the case is over? Did we get all the cancer out? And that type of data is really important to understand, which is why we fill these rooms with technology. Technology that allows us to do things like monitor or even control your breathing while you're asleep for surgery, or putting in there fiber optic cameras that allow us to perform minimally invasive surgery through tiny half-centimeter incisions. And that data is all valuable, but some of you may be surprised to hear that after the case is over, a lot of that data goes unused, or even worse, it just gets thrown away. And the entirety of the surgeon's experience that happened in this operating room gets summarized into a 1 to 2 page operative report that the surgeon themselves dictate. And that's a problem, because operative reports are incomplete, or even worse, inaccurate. In a Dutch study that was performed to compare operative notes and video, they found that 27% of the operative notes left out crucial information that happened during the operation, like an injury that caused bile to spill out all over the abdomen, or significant amounts of bleeding. And subsequent studies have reaffirmed video superiority in documenting the events that occur over the case of an operation. The data that we do keep, and we keep it very stringently, is administrative data, what you guys might better know as insurance claims codes. And that data is just far too general and nonspecific for us to really understand what happened in the operation. It's just these little codes here that apply to anybody, but I don't know what happened in any individual patient's operation. I just get sort of the big picture. So why do we care about data in the operating room? What's the big deal? Well, I think my friend Ramesh Raskar, who works here in the media lab, really encapsulates it nicely in this figure. Because the data from the operating room helps us understand why things like complications happen. And better yet, we want to use that data not just to understand why the complications happen, we want to use it to help build the enabling technologies, like AI, to help us prevent those complications from ever occurring in the first place. So imagine a surgical GPS that has been trained on millions of surgeries that are performed around the world each year. And that information is then taken and used to provide real-time feedback and guidance to surgeons to help them augment their decision-making during the course of the actual operation to avoid those complications from ever occurring. And we're in the process of building that out. So our laboratory at Mass General, in conjunction with Daniela Roos, who is just here, and Guy Rossman at CSAIL, as well as our friends at the University of Toronto, the University of Strasbourg, and Johns Hopkins, we've been in the process over the last several years of building out this type of AI technology that can analyze operative video in real time and help us to predict when a complication might occur. But no single institution alone can achieve or build out this surgical GPS, because the amount of data that's required to build out that type of decision support is just absolutely massive. So even an institution like MGH would have trouble recruiting enough patients to achieve that. And we've already talked about how the population level data that we have right now isn't sufficient to achieve that either. But what if you could pool that individual level data from multiple institutions and then confidentially link that to the population level analytics that we have now? We need a lot of collaboration to get that going. And that's what we're in the process of doing. Slowly but surely over the last year or so, we've been working with multiple institutions across the world to build out a consortium of individuals and of universities, hospitals that are interested in moving toward this data-enabled world of surgery. And so we've got about 10 institutions right now, and we're all working together to start pooling together our video and our outcomes data so that we can use population-level analytics to inform the specific care of individual patients. But we need your help. Healthcare is complicated, and I'm not a data privacy expert. nor am I an expert on building out databases. But I know that some of you in this room are, and so I'm here to sort of ask for your help. Because I would dare guess to say that you would probably agree with me when I say that providing surgeons, and therefore patients, access to the best surgical expertise possible is a good thing. So what we'd like to do is bring all these groups together and really think about how we can push forward for this data-enabled world of surgery. And so I'd like to ask you to really join me in our quest to democratize surgical knowledge, to start to put together all of this data into a central unified database, to really build out this collective surgical consciousness that can provide physicians, scientists, engineers, and others with a source of data that is trustworthy and reliable and can provide the foundation for the next wave of innovation in surgical care. Thank you very much.